President Trump is expected to release an executive order as early as next week, forcing those in the healthcare industry to be a little more transparent with patients about the prices they charge. Fox News medical correspondent Dr. Marc Siegel joining us now. So, Dr. Siegel, the question is, how is this going to affect the average American patient out there?
Well, when it comes to out-of-pocket costs, this is an extremely good thing, because a lot of times patients go to the hospital or they go to the doctor. They don't know what they're going to be paying. They may get hit with a secret bill after the procedure's done. What are you going to do then? You can't take back, the blood you had drawn or the surgery you had. So I completely think that patients need to know what they're paying. The problem is, though, that the transparency laws that they're planning here, that you're going to get the Labor Department involved, they're going to get the Affordable Care Act involved, they're going to get the Social Security Act involved. Here's what the problem is. Negotiated prices that the insurers come up with that we don't know about behind the scenes, the hospital may set a price, David, at $1,000, and different insurers pay whatever they want. And the hospital's stuck with that, and they look to average costs and end up making a profit. Well, what's a patient going to do? Find out that their insurer is chiseling and say to their insurer, I'm dropping you? Yeah. That's never going to happen. Yeah. So that's the problem.
Doctor, you just mentioned negotiating, so I'm curious, do you think Trump's driving this towards basically Medicare negotiating drug prices, which was never really allowed under Medicare Part D, and is that a good idea if it goes that far? Because Trump really seems to be after this whole crazy drug price escalation that's gone on in the last few years.
Fair point. I think that that's a secondary idea. He's furious at the idea that foreign countries are paying less, so that's definitely going to be addressed. I mean, we make the drugs here. The drug companies say it cost us $1 billion to make the drug, and then another country like Germany pays less, and they use their whole country as a block to force the prices down, and we pay more. I think that that's something that's fair and should be on the table. Medicare, across the board negotiating, I don't think we're going to get there, and I don't think we're going to get there under Trump.
What's the logical next step to this? Let's say the disclosures come out, patients have more information and more knowledge. What's the next thing that he can do? I mean, he wants to sort of really try to change the system in these subtle ways. What else can happen?
Oh, if we take a deep breath and look at this, here's where it gets positive. Don't you want to know that the doctor down the block, who's just as good as the one you're going to here, is charging twice as much for the same procedure, maybe has half the amount of experience? I want to know that, and I think that's where price transparency really helps and where hopefully this is going. I mean, if this works, it should bring down costs. You know, the American health insurance industry is saying, no, this is going to increase prices and increase costs. I don't see it. I think it's going to lead to more competition and more choice.
Adam Lashinsky in California. I mean, I'm all for transparency all the time, but what if I called you, you were my doctor, and I said, hey, you know, I don't really want to get the drug that you suggested I get because I just saw on TV that it costs $1,000. I'd rather get the $500 one. What would your response be?
Actually, Adam, that is a fantastic question, and you put pressure on me then to defend the $1,000 drug. I would then have to tell you why it's better. Maybe it's not better. Maybe you would make me think about it. Oh, that older drug, maybe I should have thought of that. I actually like informed patients, and I've been in practice long enough to not be that defensive about it.
Dr. Siegel, the Wall Street Journal reporting that the FDA has actually approved Novartis's $2 million gene therapy drug. It treats a rare deadly muscle disorder in infants. It's now the most expensive drug ever. Is it worth it?
$2 million for one use, but if it works, it extends life. It can be a cure. Genetic therapy, extremely expensive. Costs a lot to make this drug. You know, it's an orphan drug with 10,000 to 20,000 children having this. It's hard to say that it's not worth it. We're going to end up heading into this area in the future with a lot of drugs, genetic-based drugs. We're going to have to figure out how to pay out over time if the drug is successful, not pay it all in a lump sum. Again, I don't want foreign countries paying less for this drug. It's very expensive to make. It's hard for me to say right now.
Well, the Democrats, like AOC, would say everybody should have access to this drug.
Yeah, everybody should have access to it. Meanwhile, only she and others can afford to pay for it. The problem is going to be how we get the price down over time without saying they can't pay. If we say they can't, Novartis can't charge that, they're not going to end up being able to make it.
Well, the answer is competition, right? That's always how we get prices down.
And that's what's going to happen in this case, because there'll be other companies that see this drug and will make similar drugs, and then generics will come out, and over a few years it will come down the price. More and more generics is what the FDA has been going in the direction of. We need biosimilars, generics, competition.
Do you think drug patents should be shorter? Sorry.
Dr. Siegel, this is Gary Smith. To your point, yes, absolutely, competition can bring down We've seen it in the plastic surgery area where, insurance companies really aren't involved, where there is competition from everything from LASIK eye surgery to rhinoplasty. Prices have come down. It's the only part of the medical area they have come down. The problem is, and I think you alluded to this, once you get the insurance companies in between the customer and the doctor or the hospital, things go awry. Do you think we can ever take them out of it in some way, shape, or form so there is price transparency?
Great point, Gary. By the way, if you and I are going for a nose job, I bet we're going to get the cheapest guy on the block, right? Who's just as
well,
good.
The most cost-effective in any event.
Absolutely. Listen, here's a model that might work at that, getting the insurance companies out of it. I think price transparency helps. The direct care models that we're starting to see, the Henry Ford system in Detroit, I'm fascinated by that. They have 6 different hospitals involved. Employers can go right to providers and get the insurance companies out. I think that's an interesting model.
So there is hope. Dr. Siegel, good to see you. Thank you very much.